This UCSD TV program is a presentation of University of California Television for educational and non-commercial use only.
Hello, and welcome to another edition of Taking Control of Your Diabetes. Today in our series of becoming activated in your own diabetes self-management, we're going to be speaking about sleep apnea, a condition that affects a lot of folks in our society, and especially people with type 2 diabetes. Today we have my good friend and colleague, Dr. Jose Laredo. He's a specialist in sleep medicine. He's a faculty member in the University of California, San Diego, and Veteran Affairs Medical Center. We're going to talk about how to recognize it, get the diagnosis, and ways to successfully treat it. And a little later on, we're going to be speaking with one of our patients, J.C. Johnson, who has both type 2 diabetes and sleep apnea. Jose, welcome to Taking Control of Your Diabetes.
Thank you very much for your kind invitation.
Well, let's start off with the basics for our viewers. What is sleep apnea? And then we're going to talk about how common it is.
Sleep apnea is a condition that, unfortunately, most people do not recognize. But primarily, it presents with snoring, and it's chronic loud snoring. And literally, what these people are experiencing during their sleep is collapse of the throat to the point that they stop breathing. That's what apnea means, absence of breath. And each breath will eventually result in an awakening, which luckily terminates that breath and makes the patient to continue to breathe and live. But the end result is in the morning they complain of being sleepy. And as we're going to talk about today, if this condition is not taken care of, diagnosed properly and treated, it can result in pretty significant health problems.
Yeah, I'd imagine there's a difference between regular snoring and the snoring of sleep apnea. And I think for our viewers, it's just when you don't get enough oxygen in your bloodstream, a lot of bad things happen, and we'll talk about those a little bit later. But describe the snoring issue a little bit more, because you know, everybody snores, and it seems like women are always complaining about their bed partner. So does it happen more frequently in men than women?
Well, not everybody snores.
I've never heard myself snore.
At least children are not supposed to snore, yet some of them do, because more and more children are becoming obese. And in fact, we're very aggressive at treating allergies that may promote snoring in children, because eventually that could turn into sleep apnea as they become older. But there is a type of snoring that we call primary snoring. The snoring that doesn't bother you, but it may bother the bed partner. But we don't think that it has significant medical consequences. Although there is some research that may show that even just regular snoring may be dangerous for your health in the long run. But there is snoring that goes beyond snoring. This snoring eventually becomes into a complete choking event. And imagine somebody choking you and just opening your throat just when you're about to, something happening. And that's the event that's called the apnea that repeats itself over and over through the night. As you know, sleeping is supposed to be a restful period. Well, if you're choking through the night, you're not going to rest. And that has consequences, both in the morning, being sleepy, not being as smart, really. Even in men especially, there's personality changes. They become depressed. They can become very aggressive, in a sense. And all of that can improve with therapy.
Now, you mentioned before we actually started the taping today that up to 50, 60, 70% of men have sleep apnea, you know, as they get older and as they get heavier. And why do men have it more frequently than women?
Yeah, before the menopause, for every woman that is diagnosed with obstructive sleep apnea, there are about 3 men with that condition. And there's several factors. One is the protective effect of estrogen in women. When they go through the menopause, they become more like men as far as the prevalence or the frequency of sleep apnea. Also, if you would notice, when a man and a woman gain weight, the men will gain it in their neck and their chest, what we call truncal obesity. Yeah, as a woman, it was more exactly the apple as compared to the pear shape. Exactly. that the woman is. And that also has a lot to do with the mechanical aspect of choking at night, collapsing your throat, and not being able to breathe properly.
And that's why the weight is such an important issue. Well, how is it typically diagnosed? Once a partner maybe complains and says, hey, you know, you're snoring really badly, or you sound like you're choking, and then what's the next step? Because I know this diagnosis is missed for years and years and years, and with pretty bad consequences.
True. And in average, the person who shows up looking for help for sleep-related problems such as sleep apnea, they have had the symptoms for at least 10 years. And so it takes that long for eventually somebody saying, hey, there's something wrong with your sleep, go see your doctor. But there has to be a high level of suspicion. A funny case is one where the woman shows up to the emergency room with ear infections in both sides. And the smart physician says, you know, are you wearing earplugs? She says, yes. Why? Because my husband snores very loudly. So he brings the husband in, diagnoses sleep apnea, treats it, and the infection goes away, because she no longer has to wear the earplugs at night. So there has to be a high level of suspicion. And then, for the diagnosis, even with an excellent clinical evaluation, you still need to do a sleep study, which can be done either in a laboratory setting, or nowadays we can do them in the home.
Yeah, I know that a lot of folks do not want to go and spend the night in a hospital with someone watching them sleep. So I think the home studies are probably going to help pick up people, even though it's probably not as accurate as a sleep lab. Well, tell us some of the other things associated, these unusual signs and symptoms that maybe give you a clue to getting sleep apnea or having it.
Believe it or not, but one of the complaints that patients have is they can't sleep, even though they're very sleepy. They're falling asleep in inappropriate situations, yet when they get to bed, they say, I sit there, it takes me 2 hours to fall asleep. Why? It's because they fall asleep immediately, because they're very sleepy. But as soon as they fall asleep, they snort, and they wake up and say, who did that? And it was themselves. They don't realize it. They may also complain of waking up frequently through the night. At times, it's the need to urinate that wakes them up. And this also is somewhat confounding with diabetics, because diabetics sometimes, if the sugar is not well controlled, they get up and urinate. But when we are asleep and we have sleep apnea, we produce more urine than normal individuals.
Interesting.
Sometimes people just complain of being fatigued, especially women. Not sleepy, but fatigued.
Yeah.
As you know, there's a lot of people complaining of chronic fatigue.
Yeah.
And so there has to be a high level of suspicion for you to get to that diagnosis.
Now, up to 50% of people with type 2 diabetes are thought to have sleep apnea. What is the connection there, and why is that rate so high in that particular disease state?
Yeah. Obstructive sleep apnea is a condition that it doesn't just affect the quality of your sleep. Once you have an apneic event, you're literally breathing, trying to make respiratory efforts against a closed throat. That produces changes in the chest, pressure changes, that literally make the heart feel like it's in heart failure, and this is why the increased production of urine. Two, it affects the metabolic system of our bodies, and has been shown that inflammation increases in the body when you have sleep apnea. All of those will eventually impinge in various metabolic components of our body, including diabetes.
Yeah, you know, it's amazing. You know, we talk about insulin resistance in type 2 diabetes, and it's so hard to isolate all the associated conditions, from heart disease to sleep apnea, inflammation, all those areas. And so type 2 diabetes, it seems like the more we study it, the more we don't know. Well, we're going to come back and talk about lifestyle a little bit more, but first we're going to see Michelle, who will show us how to do some particular exercises that will help you fall asleep and stay asleep.
Doing 20 minutes of aerobic exercise in the early evening makes it easier for you to fall asleep and stay asleep. When it comes to getting a good night's sleep, the best time to exercise is in the late afternoon and early evening. Exercise makes your body temperature rise. It takes a few hours for your temperature to drop again. It's this drop in body temperature that makes it easier for you to fall asleep and stay asleep. Therefore, if sleep is what you are aiming for, do not exercise vigorously right before bedtime. Allow 3 hours for your body temperature to drop and your muscles and circulation system to calm back down. The best type of exercise that you can do to help you sleep better at night and give you more energy in the day is aerobic exercise. Some examples are walking, biking, swimming, and dancing. So pick your favorite activity that keeps your heart rate up and your muscles pumping. Check your blood sugar levels before and after exercising.
Thanks, Michelle. I think we all really know that aerobic exercise is good for our health, and it really leads to so much better sleep. And thanks for those tips, and maybe we all can do it more regularly. Well, I'd like to introduce my patient, Dr. Laredo's patient, J.C. Johnson, who's come on the show to share his personal story about living with type 2 diabetes as well as sleep apnea. J.C., thanks for coming on.
Sure.
Tell our viewers how you discovered you had sleep apnea a couple centuries ago, decades ago.
Okay. I'm a respiratory therapist, and I talked to one of the technicians in the sleep. They used to do nap studies, and I asked them if I could borrow a machine because I had problems with snoring. And so I borrowed the machine and a manometer, and I took it home, and I told my wife, I'm going to put this mask on, and if you hear me snoring, wake me up. And I made 2 adjustments. She woke me up twice. After the third adjustment, she never woke me up again.
And you've been on CPAP for 21
years. And then the next morning when I woke up, it was just like having a brand new pair of glasses on. It was like a new day. So I knew that the CPAP worked.
And you eventually got officially diagnosed, or you just borrowed this guy's CPAP and he's suffering?
No, so. I went to my primary care and told him that I know that the CPAP works, but he said that he couldn't just order a CPAP. I would have to have a sleep study done. So he sent me to an ENT specialist. Then the ENT specialist sent me to a sleep lab. And then once they got the results back, he could order a CPAP machine. And
it's just interesting that you work with Dr. Laredo in the sleep clinic at the Veteran Affairs Medical Center. Now, you were saying, Jose, that this really dates back to a particular time when sleep apnea was just being recognized.
Yeah, really, JC is one of the pioneers. Sleep apnea as a disease, as a condition, was first described in the medical journals around 1965. And the treatment that JC has is called CPAP. It stands for continuous positive airway pressure. That was introduced to medical therapy back in 1984.
That's not that long ago.
Not very long ago. No, that's not very long ago. I remember being in medical school. I graduated from medical school in 1984. I never heard about sleep apnea.
Yeah, well, I did fall asleep during my professor's lectures. Maybe I had it at that time, too.
That's what I tell people when they fall asleep in my lectures. You know, it's not because of me, it's because I may have sleep apnea.
Just don't snore.
That's right.
Well, JC, you eventually came down with type 2 diabetes. Is that correct?
Yes, yes. And I had allowed my weight to get up quite a bit, 265 pounds.
Oh, wow.
So when I got diagnosed with diabetes. But once I started going through the training and learning more and more about diabetes, then I started implementing a lot of the things that I was told to do. And
how'd you lose the weight?
I just started back regular exercising, and mostly just walking and riding my bicycle.
Well, you know, I appreciate that because most of the folks out there can't do these heroic measures that we see these extreme athletes do. And I know that you and I have the same philosophy about weight loss. Why don't you mention that? And also, I wanted you to jump in there, Jose, and talk about the relationship between type 2 diabetes and insulin resistance and sleep apnea a little bit more.
Yeah, I wanted to say, it's interesting how JC was diagnosed with obstructive sleep apnea. In fact, he used therapy to show that he had it. Basically, that's what he did. Eventually, he had a sleep study.
Therapeutic trial. You know?
And there is a very strong association between obstructive sleep apnea and having diabetes and vice versa. There is good evidence that even in those people who don't have the diagnosis of diabetes, if you do careful measurements of their insulin resistance, their sugar, their response to blood glucose, to let's say a glucose load, they will definitely be abnormal as compared to normal individuals, and they will be worse than people who are just plain obese.
Interesting.
They're sort of above the obese individual. And the worse, the more severe the sleep apnea, the more severe the derangement in sugar metabolism is. So it's very interesting. Now, as far as gaining weight, you and I have the same philosophy. It's not really what you eat, it's how much you eat. I usually tell my patients, although they don't always appreciate it, you know, look at cows. They only eat vegetables, right? Yeah, look how big they get because they eat all the time. And they eat a lot.
Well, you know what? It's so true. You know, you can't take someone's lifelong eating habits and change it drastically. You just got to look at the amounts. Now, I wanted you to tell our viewers briefly, when you don't get enough oxygen in your body, a lot of bad things can happen. I call it waterboarding. You know, you hold back the oxygen until you're about to have something really bad, and then your body just snores super loudly. I know it can affect your brain, your blood pressure, your heart rate, all that kind of stuff.
Often people with sleep apnea that it's untreated, they wake up with headaches in the morning. It takes them a little while to get rid of the headaches. We feel that has to do with low oxygen in their blood at night. And it's not just low oxygen continuously. It's a repetitive insult. Every time they have an apnea, the oxygen can drop tremendously. Normally, we have an oxygen level in our blood of about 98, 100%. When you have an apnea, I've seen it go down as low as 25, 30%.
During these
sleep studies, yeah, exactly. And then it comes right up. It's a tremendous insult, a tremendous stress into the cardiovascular system, the metabolic system. As far as diabetes and sleep apnea, one of the changes during sleep apnea that correlates with the abnormalities in sugar and insulin in these patients is how low their oxygen gets. The lower the oxygen gets at night, the worse their diabetic or pre-diabetic symptoms are. So it's really a dangerous condition if not taken care of, especially if it's an insult that happens every night, day in, out and day out.
I mean, think about it. If you're an anesthesiologist, you would be fired if you let the oxygen go that low that many times during a surgery. And then this happens every single night for people that are undiagnosed for years. Do you, thinking back, JC, how you feel now with the weight loss, with the CPAP, compared to how you felt before? Maybe for our viewers, you can... I mean, you told me you would never go anywhere without your CPAP machine.
That's true. And that's... Well, back then, I almost hated to even try to go to sleep because I was going to disturb a lot of people, and then I felt so tired the next time, even though I thought I had gotten some sleep. But when I woke up on that CPAP machine, and it was like a brand new day, I knew I would never turn that thing loose again.
Well, we appreciate that. Well, we're going to... After the break, we're going to see some of these CPAP machines to let our viewers know that, yeah, this is something that's livable, especially for the benefits. Well, one thing I was really surprised to learn is that the foods we eat can actually affect the way we sleep, much more than just drinking a lot of caffeine at night. So let's hear what Janice has to say about that.
We know that a good night's sleep is so important for diabetes management, but there are nutritional factors that can get in the way of a good night's sleep. High-fat foods such as pizza, high-fat entrees, chips, crackers, and cheese can actually aggravate a condition known as GERD, or heartburn, which can disrupt our sleep. We also need to take into account high caffeine drinks, such as coffee drinks and energy drinks. That can fool our bodies into thinking it's getting enough sleep when it actually hasn't. And alcohol is also a very powerful sleep disruptor. Again, not getting enough sleep can disrupt hormones that affect our appetite, our blood sugar, and our blood pressure control, leading to possibly more risk factors for diabetes complications. A stop at the vending machine does not need to be a disaster for your diet or your diabetes. Avoid the salty, fatty chips, cheese and crackers, pork rinds, and very high-calorie and sugary juice drinks or sodas. Stay with health-enhancing foods, including nuts, yogurts, milk drinks, as well as low-calorie granola bars that can enhance your health instead of detract from it.
Thanks, Janice. I never realized that some of those foods you mentioned can actually keep us up at night, and I think anything we can do to improve our quality of sleep is going to pay off. Well, Dr. L, give us a brief overview of therapies other than the mainstay, which is the CPAP machines, which we'll get to in 1 second.
Sure. Anybody who has sleep apnea, who's overweight, we highly recommend that they lose weight. And there's many ways of doing that. But beyond CPAP, we have something called the jaw advancement device, which is a device that basically goes in the teeth like a retainer and pulls the jaw forward.
And it makes your passage
It literally
clearer.
makes the passage bigger. It keeps it tense during the night and keeps it, prevents you from snoring. It's good for those people who have mild or moderate sleep apnea and who are thin and young and good teeth. And then at number 3, we have surgery, various types of surgeries to open up the opening of the throat. Again, that is left as a last resort because often you can't predict how you're going to respond to the surgery. And if you don't like how you feel, well, you're stuck with it.
And I understand it's pretty major surgery.
It is significant surgery, let's put it this way. It can go from as little as taking off the uvula, which is a little punching bag in the back of your throat, to moving your mouth forward.
Right, right. I know patients, it took 2 or 3 years to get through that process with braces before and after and things like that. Well, let's get to the mainstay. JC, thank you for bringing your CPAP machine, and maybe you can show our viewers how it works and how you wear it at night. And we're also going to let you listen to how quiet it is so that you can not be afraid of keeping your spouse or your partner awake at night.
Okay. When I put the mask on, the machine will come on by itself.
It senses that you're putting on the mask?
It senses me breathing.
And when he puts it on, I'm standing 2 or 3 feet away. I can't even hear it.
I can't hear it myself. It's
yeah,
very quiet.
Yeah, that's extremely quiet. And you wear that all night long?
All night.
Okay.
You notice that he can't open his mouth very well because air will tend to come out. And you need to keep the mouth closed to keep the throat open.
I see. And I was going to say, that's kind of a good excuse for the spouse, you know. Okay, if you're tired of hearing your partner, put on your CPAP machines.
No, in fact, wives often demand that the man put on the CPAP.
Yes.
Because they lose sleep when you're snoring. Here you have 2 types of machines.
Yep.
They're made by 2 different companies, but they're basically equivalent. CPAP is the most effective therapy we have. Almost everyone who's able and willing to use it will get benefit from the CPAP. However, even though it's very effective in controlling the choking events, the apneic events, not everyone's able to tolerate it. We were not born with something up our noses and air blowing up our nose, and so not everyone is willing to put up with that. But beyond that is the most effective thing we have, even though it's somewhat cumbersome, because you have to put it on, keep it, wash it during the night.
Now, I see that each one has 2 components to it. Maybe you can pull this apart for our viewers, JC.
Yeah, what JC is doing here is taking the pressure generator, which is the CPAP proper, away from the humidifier. Someone who lives in San Diego who may have Santa Ana's, you need a humidifier to prevent your nose and your throat from getting dry. But if you live someplace where it's very humid, all you need is this component right here, which is the CPAP proper.
Okay, in both of your experience, what % of people who are given a CPAP machine are successful with it? And what % just can't use it for whatever reason?
Very good question. I think I can answer that. The old literature used to say that 50% of people could not use it. But now as the technology has improved, machines are very quiet, they're more comfortable, have features to make it comfortable, up to 70–80% of people are able to use it long term.
But one thing I'm pretty disappointed, you know, why isn't there a place to plug in your iPhone or your iPod during in these machines? It seems like they have those on everything else. No, I'm just kidding, but I know for a fact that I've seen some of the older devices, and it's so much more livable these days, and it makes such a huge difference. I have patients who would not go any place without it, and once again, they travel quite a bit. And I'm glad we did a show on this topic. So what I'd like to do is leave our viewers with something to remember, that sleep apnea is a very common condition, especially people with type 2 diabetes. The diagnosis is typically missed for up to 10 years. That's basically 10 years of not getting enough oxygen several times a night. The therapy is extremely successful and can really improve your quality of life amazingly, and what I've seen, what JC has shared with us. So in closing, and until next time, I'd like you all to remember that you have the main responsibility of taking control of your diabetes. You are your own best self-advocate. Be smart and be persistent. So take control of your diabetes. You owe it to yourself and your family. I'd like to thank our two guests, Dr. Jose Laredo
Thank you.
and JC Johnson. Thank you so much for being on the show.